Welcome back to the Fostering Financial Victories podcast. Thanks for joining us and spending some time with us today. I am joined today by Erik, Rector. So we are going to talk through probably one of the most confusing topics that the older generation of Americans have to deal with every year. So we're going to talk about Medicare. So Erik, I'm going to lean on you a lot because you are the Medicare guru of this panel today. Tell everybody a little bit about yourself before we kind of get into this.
All right, Erik, thanks for having me, first of all. And I like to say that we hear that it's bonfires, sweater weather, pumpkin spice latte, and Medicare. So can't wait. This is super fun. I'm going to make it as entertaining as possible. But a little bit about me. I have been a local Greenvillian my entire life, born and raised here. Went away to college for dance, performance, and choreography. So that's a whole nother podcast, how you become a dancer becomes an insurance agent. But
seems logical.
Yeah, completely logical.
Get it?
Completely logical. We use the numbers 5, 6, 7, 8. That's about the extent of that. So here I am 14 years later. I am contracted with South Carolina Farm Bureau Insurance. We write through numerous different companies, and I absolutely love my job.
Awesome.
So I'm excited to be here, and let's get started.
All right, cool. So I'm sure if you are of the age where Medicare is becoming important, your phone calls have probably increased. Your mailing has probably increased in your mailbox. Your mail carrier is probably wondering, what are you doing? So what is going on right now as we get into this season of Medicare, and what's the timing of everything?
Okay. So let's just talk about general right now. You will hear Medicare on TV. Yes, your telephone is ringing. You're bombarded. Now, let me just say this. If you are you're nowhere near the 65 age and you're getting bombarded, you need to be cautious of that too, because I've had those scenarios too where people our age or even younger are receiving this stuff. And so there's either a social security number situation going on, or there's something messed up. So you need to check on that too. But furthermore, we're about to start annual enrollment.
Okay.
So two topics we're going to talk about: annual enrollment and open enrollment. All right. So annual enrollment for Medicare starts on October the 5th, and it runs through December the 7th.
Okay.
All right. So right now we're only going to talk about annual enrollment. Okay. And a little bit about the key points about what that means is if you are currently on Medicare with a supplement, we're going to talk about that in detail in a little bit too, but if you are on Medicare with a supplement and you want to move to a Medicare Advantage plan, now is your time. This annual enrollment is the time to do that, all right? So if you're on Medicare with a supplement and you've heard about the Advantage, you want to move to it, this is your opportunity from October 5th to December 7th.
So anybody already above age 65
or turning 65.
Now's your time.
Now's your time. That's right.
Okay.
All right. Or if you're on an Advantage and you're like, I don't know that I like some of the issues in this plan that I have, and I'm going to switch. Now's the time for you to switch to a different Advantage plan. Whatever you see, you can shop them, you can look at different things, so you can switch your Advantage plan from one to another. Or you can drop Advantage plans altogether, okay? You can just say, I'm over the Advantage, I don't want it anymore. Open annual enrollment means you can drop your Advantage plan. Or everybody has a drug card if you're on A and B, or you should, and we'll talk about that in a little bit. And if you want to change your drug card, annual enrollment is the time to change your drug card. So let's recap those things, all right? If you're on Medicare with a supplement and you want to move to Advantage plan, October 15th through December the 7th is your time to do it. If you want to switch Advantage plans, if you want to drop your Advantage plan, or if you want to shop your prescription drug. All right.
Okay, so it's a pretty important time frame is what I'm gathering.
That's correct.
Yeah.
That's correct. All right. Then, after we get through annual enrollment, Santa Claus comes, we do the whole Happy New Year thing, which after 2020, I think we're all going to be ready to move to 2021. So, open enrollment starts January 1st and runs through March 31st.
So you got really 6 months coming that's going to be Medicare related.
That's right.
Okay.
Now, this is only people that need to listen to me about open enrollment, okay? If you currently are on a Medicare Advantage and you want to change to a different Medicare Advantage, so annual enrollment and open enrollment go through. And if you don't want to hear this, just don't listen to this part, okay? But I have to say it because it's part of it, all right? If you want to drop your Medicare Advantage altogether, what you need to know, though, is you can't change your drug card at this time. So drug cards are out. They're only from October 15th through December the 12th.
There needs to be, it sounds like there needs to be like a flow chart.
Well, they tried that. It didn't work out so well.
Well. If any of you engineers out there have any ideas, that'd be probably a good idea.
Absolutely. Absolutely.
Okay, so next 6 months, really big for Medicare movement of things. So let's say somebody is not on it now and they're coming into that age where it's relevant to them. How do these time frames apply if their birth date is not during those 6 months?
Okay. So if your birthday is not in those 6 months, if you haven't turned 65, you don't need to worry about this right now, okay? Don't let this clog your brain right now. So let's talk about that initial enrollment period, okay? Which if you get ready to turn 65, all right? So you've got a 7-month period if you're about to turn 65, okay? 3 months prior to your 65th birthday. The month in the middle is the 4th month. That's when you turn 65, and then 3 months after. That is your initial enrollment period.
Okay.
You can go on a Medicare Advantage plan or a Medicare Supplement plan at any time throughout that without any underwriting. Or that's just like your open window.
Yep.
Have at it.
So does underwriting come into play during open and or annual enrollment?
All right, so let's clarify that a little bit. The biggest myth is that everybody thinks there is an open enrollment for Medicare supplements. There's not. Open annual enrollment is just for an Advantage plan, okay? So let me explain this. If you are currently 65 and you have Medicare A and B, and you have a supplement, whatever that be, G, H, F, what have you,
Mm-hmm.
I would seriously consider sitting down with someone and looking at what you have versus just jumping ship and changing something. Because you can move to a Medicare Advantage plan, all right? And we can dissect this out to make it a little clearer, but you can move to an Advantage plan. If you are not happy with the Advantage plan within a 12-month period after going to it, you can move back to the exact plan you're on. But you can't switch to another one without going through underwriting.
Got it.
So that means that if you have developed any health issue or anything like that, they can rate and decline for that.
Okay, so let's hit pause and go into these two options. So you've talked a little about the Advantage and the supplement piece.
Mm-hmm.
High level, let's talk about what each one of those are.
Let's just do the 4 parts because I think that's going to be the best thing.
All right.
All right. So the 4 parts of Medicare, basically. This is the basic Medicare 101. All right. You've got Part A, which is hospital insurance. It covers hospital stays and services provided by a skilled nursing facility. All right. Got that? Are we good with Part A?
Go.
All right. Part B, outpatient Medicare insurance that covers doctor's visits and preventative health care. So that's your Part B. Now, Plan A has a 0 premium if you qualify for Social Security benefits, okay? That's all I'm going to say about that right now with that, all right?
Okay.
Plan B has a cost. The standard cost, and don't hear me wrong, standard. So your cost may be different based on what your income was or has been. I would highly recommend you speaking with your wealth advisor, anything that you need to make sure you're doing the right thing. But the standard cost for 2020 was $144.60
Per person,
all right.
right?
That's per person. That's
Per
right.
month.
So per month, yeah. So Part A and B is what you get with your red and your blue card. All right. Outside of your red and your blue card, you're going to hear 2 things: Medicare Advantage, which is Part C, and Part D, which is your drug card.
Yep.
Then you have this little extra thing you're going to hear called Medicare supplements or Medigap plans.
Okay.
All right. So A, B, C, D, and then you got this over here called the supplement or the Medigap.
All right, hold up. Why in the world is this so complicated?
I don't know.
That's probably another discussion, right?
That's another discussion, another podcast.
That might be an invite for politicians to come and join us and talk about it.
Oh,
all right, let's go. Keep
okay.
going.
All right. So, all right. So where are we? So we've gone through the Plan A as a 0 premium if you qualify for Social Security. Plan B is $144 generally right now for 2020
with an asterisk.
All right. So Plan C, Medicare Advantage.
Okay.
All right. What you need to know about that is that basically you are you don't the C is a plan that's approved by Medicare and run by a private company.
So an insurance company.
Yes.
Okay.
And there's lots of different ones out there. You need to find the one that is best for you, okay? 9 times out of 10, well, I'm not even going to say that. All the time, most of the time, the Medicare Advantage is going to be cheaper than a supplement plan.
Okay.
But you're opening yourself up to an annual deductible.
Okay.
And that's all we're going to say about that,
It's just kind of like normal insurance that people are used to.
Exactly.
Got it.
Exactly, okay?
Okay.
With Medicare Advantage, you get basically your supplement for your Medicare A and B and your drug card together, okay? If you choose to go a supplement route, which is going to be another premium, generally more expensive, but they have some really neat ins and outs of those. You need to look at them, especially based on your health and what you have going on in your personal life.
Okay.
And so that's why I always say, seek it out, find somebody that you trust that can help you talk to you about this. All right, so you got a supplement that you're going to pay a premium, and then you got to buy a drug card.
But you wouldn't do a supplement and Advantage.
You can't.
Okay. Yep. So it's either or.
It's either or. Okay. That's right.
All right. Okay. Yeah. So now that we've kind of put the framework there,
right?
Is everybody good now? Is everybody kind of glazed over? Because I think I am. All right. So if you're a new enrollee or a current enrollee making the changes now, what are some high points that they need to be aware of or know what they're looking for? Is there an easy question to this as far as how they make that decision?
This is a hard one because let me say, I got really involved in this when my grandfather, who was always very savvy and very with it, he kind of got older and was not, he had a certain supplement plan, and I needed to talk some things through with that. And so I, being in insurance, called for my mother, and it was just insanely difficult. And so shocking, right?
Yeah.
So I started digging into it because I was not really into that side of it, and it's kind of become my baby because I want people to feel comfortable with it, and I want them to understand whether, what questions you have. So what I say first is you need to know what your health looks like. Like, tell me, what's going on with you this year, but if you're turning 65 or if you want to change whatever you're on.
So kind of thinking through what pre-existing
That's right.
possibilities are there.
Yeah, what's happened in your past, what's going on now. If you're completely healthy, that's great. We can't predict the future.
Yep.
But your past health can kind of tell us, okay, let's talk about this. What medications are you on? Things like that. And ultimately, it's going to be your decision, but we can kind of talk through and look at what the benefits are versus on one plan versus what they are on another.
Okay.
And all plans are different. That's the biggest thing. That's why I encourage people that you need to seek out someone that you trust, that you can talk to about different plans.
All right. So in this day and age of technology, with so much information being available at your fingertips,
right?
Talk through some of the mistakes that people might make unknowingly by just doing this research on their own and not exploring it from a professional's perspective who's in the weeds of this all day long.
Right. So things change with this all the time.
So
okay.
Annually, you think it?
Oh, absolutely.
Okay.
Absolutely. Everything can change annually. So just like, for example, we're getting ready to start on October 15th. I don't have 100% what the plan guidelines are going to look like, what all the products that are going to be offered, what the drug cards are going to look like. So things change a lot, just in any healthcare situation. So what we have to do is basically, that's once again why I seek it out and say, look, let's talk about these things. Let's talk about what's going on with you. If you are going to just Google for Medicare open enrollment, make sure you're looking at, like, if a provider, strictly a provider, is sponsoring that website, they're going to just talk about their plan. So, I always encourage maybe go to the Medicare.gov and they'll talk through the basic definitions of what it is, who's eligible for it, what's your initial enrollment period, what's a special enrollment period, all those different things. There's also, if they're tech savvy, which I tell all of my clients, and I'm sorry, I'm going to pop it up right here on my phone, but it is, and you can even Medicare.gov, what's covered. And you can type in your question, you can do anything, and it'll pop up. So use a general, when you're looking, a general.
So you just said something, it changes every year, and this opens on the 5th of October. We're sitting here 12 days from now, essentially. And they still haven't.
The 15th of October.
Okay, 15th.
15th of October.
And they still haven't put out what the final details are.
Well, as a provider, we're not going to talk about them until we got them pinpointed, and they don't want us to. So you're exactly right.
So you do this every day and talk about this extensively, and you don't have the final details yet. If I am just average person who is exploring what options are there, the information is not ready yet. You're going to have a very tight timeline to make a decision.
So
you need to find somebody to help.
So you got October 15th to December 7th with actually what so that's going to, they're waiting, not really waiting, but we haven't gotten so much of the details of what the Medicare Advantage plans look like or what their benefits are going to be, where it gets into like the nitty gritty details. So I encourage you though that you can either seek out someone you trust in the field and talk to them about, the differences, which is what we've kind of talked about today, or look at Medicare.gov just for those high points. So when October 15th comes around, if you have an agent or you have someone that you work with, you can go to them and say, tell me what my options are. Because we'll have them on October 15th.
Got it.
Yeah.
The day of.
The day of.
Got it.
Yeah.
All right, so how do you make all of this happen? If you are trying to make a decision and you aren't working with somebody, what are the steps that they'll have to take to make certain that everything is right?
All right, so first things first, we need to make sure that they're enrolled in A and B, okay? So they can go on to Medicare.gov, they can call the Medicare office. I know that sounds scary, but really they're great people and they do try to help. So you gotta have that red and blue card, number one, if you're just now turning 65. So that's if your initial enrollment period. If you've got it and you're changing, what you need to do is, again, seek out whoever your agent is, or call me if you need to, and we can talk through, these are your options. Let's talk about what your needs are. That's going to be the key thing. It's not about, because I might have someone call me, I want to change, but after we talk, I'm like, let's talk about what happens if you change. So let's talk about these differences.
Yep.
That might not be the plan, and you're bombarded with all this information, and it still might not work for you.
Sounds like there's a lot of opportunity to mess this up.
Absolutely. There's a ton of opportunity, and it's scary for people. And this is one of the biggest reasons I got dove into this stuff, because people were changing and they didn't need to change.
Okay.
It's not about what people need to understand in this. And as an agent, it's not about a sale. It's about people and caring with what they've got, because this is their health.
Yeah.
And this is the long run of it.
Well, and there's some real ramifications here if you do happen to make a bad decision.
Absolutely.
And
Absolutely.
It's not that you didn't know about it, you just didn't know.
That's right.
Right? So, okay. What happens if you did screw it up? How do you fix it?
All right. So if you screw it up and you move to an Advantage plan off of your supplement currently, you got 12 months that we can fix it, okay? Outside of that 12 months, everything goes back through subject to underwriting.
Okay.
So if you screwed it up, you definitely need to find an agent that can help you as quickly as possible.
Are there any tripwires that are in place for someone who is getting ready to enroll for the first time, to where if they don't do A, B, and C in a timely fashion, are there any issues there?
All right. So let's talk about the only one that's got the ongoing issue is generally if you're in that 7-month window, for say the 3 months prior, the 4th month of turning 65, or the 3 months after, we can fix anything in that. Okay. And you're going to get bombarded. So they're going to remind you need to do this. So I honestly have not had a ton of issues with people forgetting to do that, or we might have not enrolled in B and we just fix that with the Medicare office, that kind of situation. The biggest thing that we see is if you enroll in A and you enroll in B and you get a supplement, but you don't get a drug card. Okay. All right. There is a penalty that will be applied to you from the day you do get a drug card forever. It never goes away.
Hang on.
Yeah.
So hold on. So if you let me unpack this a little bit. So if you do A and B and you elect not to take the drug card, is that an option, or is it just something you just forget to do?
Well, A, they've forgotten to do it, or B, some people are like, I'm not on any drugs. I don't want to pay this additional premium for this. I'm not doing it.
Okay, I get it. All right.
Okay, but hear me this. We don't know what's going to happen down the road. So say that next annual enrollment, you're like, I need a drug card now. Okay, come see me. Well, there's this crazy equation that we're not going to talk about, but this crazy long equation that figures out what your penalty is because you've already gone a whole year without a drug card. So not only are you going to be paying for the drug card, but you're going to pay the penalty to the government because you didn't originally get one.
So premiums you mentioned for Part B, Right, $144 a person on average.
On average.
Standard. Right.
Mm-hmm.
How do they pay them?
Well, you can either A, have them deducted from your Social Security. If you were part of railroad, it could come out of your railroad stipend from that. You can auto draft. You can mail in a check. However, you would when you set up for your Medicare Part B, they will set that up with you.
So you mentioned Social Security. So if you are of the mindset that I'm not going to take Social Security at age 65, I'm going to wait, then they're just basically paying it like a check or a draft or
right.
however. Okay.
And so let's give a scenario of that. Just so I have people that, okay, I've worked till I'm 68.
Yep.
All right. So he or she has been on a group provided health care. They're like, we're not taking any of this yet. When they get ready to retire, that becomes their initial enrollment period. So they're coming off of a group provided program, medical health care.
Do they still have to declare for Part A even while they're working? Past age 65, or can they defer that?
They can defer that.
Okay, so if you're over 65 and still working,
you can
good.
Wait. And some people, go ahead and do everything because they're sending you all that stuff. But when you're turning 65, they're going to be bombarding you.
And so the piece about the drug card, so if you are actively covered by a group employer plan, that penalty is not applicable?
No,
is that what I'm hearing?
That's right, because you haven't enrolled yet. Yeah, that's right. That's exactly right. That's only if you enroll, if you basically have a supplement or it wouldn't apply to the Medicare Advantage because you're automatically going to have a drug card in there. But if you have a Medicare supplement in addition to your A and B and you don't enroll in the drug card, that's where the penalty is going to come in.
Okay.
But if you're still working through age 65 birthday, keep it trucking, you're not going to do anything, none of this applies until you retire and come off of a healthcare program and you need the A and the B.
Okay. So flip side of that, if you are pre-age 65 and have retired, what do you do between
65?
Yeah, what do you do between that age and
65.
Medicare age? Yeah, how do you approach that?
You get to get an individual policy. That's a whole nother podcast for a whole nother day, okay?
You want to talk about those too?
Not today.
Okay.
Not two in the same day.
All right, just checking.
Yeah.
Okay. What else do people need to make certain, from the 101 mindset on this? How is there anything else that they need to know about from whether it be a tripwire or whether it be something that, hey, you just cannot afford to make this mistake?
You need to make sure that if you're turning 65 or you are 65, you've got that A, you've got that B, you got the red and blue card. That is you can't even talk. I don't even let you talk to me without the red and the blue card, or I want to know it's in the mail coming to you. Okay? So make sure that you're on top of that. Make sure that at any time that you've got questions, you're writing these down, because the person that you're going to entrust to help you with this needs to be able to answer those questions and needs to be able to help you work through all of that.
Okay.
One thing I did want to go back to, because we talked about the under 65, so I'm going to briefly talk about this, okay? Who's eligible for Medicare? So there is that window that if you're under age 65 with a permanent disability, you are on SSDI or suffering from basically kidney dialysis, anything that is a replacement or any other medical conditions, you would be eligible, but you have to have your A and your B.
So even
that is a special needs plan.
So even you're 35, you
absolutely,
if you hit those,
if you have these issues.
Okay.
And those you definitely need to kind of work through with someone.
Got it.
Because that's a definite special needs plan.
Okay, that's good to know. Mm-hmm. All right, so as we start to kind of wrap this up, I don't think there's a whole lot more we need to get into from the nitty gritty and the details, because that's a rabbit hole that we may not come back out of.
That's right.
Anything that from a planning takeaway perspective, I'm starting to hear through this with clients who are at this age and above, because their phone is ringing. People are calling them. Mm-hmm. I think the biggest planning takeaway that I have gotten from your point of view is have the discussion. Don't avoid it, because there could be significant ramifications of not taking the time to explore this. Mm-hmm. This is a problem that could arise, and you may not even realize you're creating it.
That's exactly right.
Okay.
That's exactly right.
All right.
If you have any questions at all, seek out the person that can help you and talk through this. If you still have questions and they're not answering them, they can find those answers for you.
Cool. All right, so let's stop it there.
Got it.
I've got 2 questions that I'm going to ask you that I've asked every single person that's joined me on this podcast. First one, I think these are going to be really good. First one is, if you could buy anything in the world, regardless of cost, what would it be?
I can buy anything in the world regardless of cost. Oh, Erik,
I know.
come now.
Put you on the spot.
Oh, gosh. I mean, it has to be a thing. I have to buy a thing.
No, it could be anything. Could be a thing. It could be anything.
I want to buy a cure for cancer.
Wow. Haven't heard that one. Last thing I heard was that big was being able to teleport.
Oh, well, I don't care about that.
I like that. Okay. All right. So the last two things you spent money on.
All right, hold on. Today. Okay, it was today.
Yeah.
Gas.
All right.
And coffee.
Okay. Very practical.
That's right.
All right. Okay. So again, thank you for joining us. Take some time to tell everybody how they can find you if they want to reach out, connect, have questions, and talk about this in more detail.
All right. Hey, seek me out. I'm happy to help you in any way possible. You can reach me on my cell phone at 864-616-6910. By email at Erica, ERICA, Rector, RECTOR, at scfbins.com. You can also look me up on Instagram at Erica S. Rector.
Awesome. So if you didn't get all that, we will list all of the contact details in the notes section of the podcast episode. So if you just click into that, you can see all the details there. Thanks for joining us. If you have questions, suggestions, comments, feedback,
Absolutely.
we're open to feedback. You can email us from our website at fostervictorwa.com. You can also follow us on Instagram at fostervictor wealth advisors. Thanks again for coming.
Thanks for having me.
Please share this with a parent, a friend, whomever, and hope to see you next time. Thanks.
Absolutely.
Information contained in this podcast was intended for general use, not to be used as specific advice. For content tailored to your personal situation, please contact one of our wealth coaches.